Isaiah. I'm Dr. Klein. I'm just here to check your incision.
Okay.
And who might this be over here?
This is my husband, Pablo.
Oh,
Nice to meet you.
Yeah. Are you looking for anything specific or just checking it out?
I'm just checking it out to see if there's any redness or if it's swollen around the area of the incision, as well as any drainage of pus or blood.
Okay.
If you find anything, what would that entail?
That would be like a possible infection.
Okay, how would you treat an infection if you find one?
Yeah, usually with antibiotics. If the antibiotic would depend if he has any allergies to any medication or anything like that.
Sounds good.
So I'm gonna take a look here.
Okay.
Real quick.
Go ahead.
Looks all good. Do you have any pain or discomfort?
I'd say I'm a little uncomfortable, but it'd just be about a 4 out of 10.
4
I'd
out
say.
of 10?
Yeah, it just comes and goes. So.
And that's from a scale of 0 to 10?
Correct. Yep.
Okay, and then the pain is just in that area?
Right. Yep. Just in that area.
Yeah. And is it just like tolerable enough?
I'd say so. To a point.
So?
Yep.
To a point. Okay. So I'll let the nurses know, and then they'll most likely bring in here some pain medication.
Okay.
They'll go with some more information about it too.
Sounds like a plan.
Okay,
Thank you very much.
Good. No problem.
Thank you.
You're welcome.
Hello, Isaiah.
Hi.
How are you?
Not too bad. Yourself?
How are you doing?
Pretty good.
Good. My name is Ellen. I'm one of the nurses to be help with discharging.
I'm Madison. I'm also going to help discharge you.
Sounds good.
First, before we go through your discharge paperwork, the doctor expressed that you had some pain, so we're going to take care of that with giving you some pain medication.
Okay.
We're going to give you some Narco. But first, can I have you verify your name and date of birth?
Yep. Isaiah Aguayo, 9/5/2004.
And I see you have no allergies, correct?
Correct. Yep.
Okay. So here's your Narco.
Thank you.
On the discharge paperwork, I will be putting the time that you just took it, because Narco you can only take every 6 hours. So you will be able to take it from 6 hours from now. Okay. And we'll have the prescription here, so you can go to your pharmacy to get it filled. It's just important to go by the directions. Okay.
Okay.
Also, it's good to be looking at your incision on a daily basis. Like the doctor said, if it's got any edema or any pus or bleeding or anything that looks abnormal, give the doctor a call so they can look at it, okay?
Okay.
And with that, you just want to make sure you have good hand hygiene, you know, not going to be taking any baths and that kind of stuff, because you don't want to get that incision too wet.
Right. Okay.
We have a pillow in between your legs, and that's to help remind you not to cross them, because that can pop up your socket there. We don't want that, so you'll be needing to do that at home. Okay. And the other thing is not supposed to bend over. So
Right. Yeah. I don't want to come back here.
yeah,
so
so
I'll try
it's
and avoid
important if you can have, you know, things up where you can reach them. PT can come in and show you with some fancy tools how to get your socks and stuff on.
Okay.
Or just have family members help you when things are on the floor.
I can totally help him bend over.
Okay. It's good that you have that kind of support.
And
Something
then
like that.
with activity, it's remember to try to keep up with your normal activity levels
Okay.
as much as you can, but you don't want to push yourself. If you're having pain in your incision site, it's a good indicator to slow down because something could be wrong. And then about the TED hose.
Yes, the 10 hose you have on, you'll need to keep them on for the next about 4 weeks. You can take them off at nighttime, but that is to help with preventing blood clots in your legs. And you know, when you're not able to move like normally you do, sometimes that happens. So we're gonna do that. Okay.
How long do you think it's going to take until he gets back to normal?
It all depends if he follows a lot of these instructions we've gone over. Eating well helps, and not keeping good hygiene, oral, and even with your hands and all that just helps keep from preventing infections.
Okay.
So it's all going to depend on your body as well. So
And with your diet, it's important to include foods that are high in protein, fiber, and then vitamin C. The protein and vitamin C are good for assisting in like your wound healing, can help the process a little bit faster, and then the less time your wound is open, the less likely you are to develop an infection or complication. And then the fiber is, since you're prescribed an opioid, you're a little bit more likely to have constipation, and the fiber can assist in prevention.
Okay.
Do you have any questions, either one of you?
I don't think so.
Yeah, I don't think so.
Well, everything that we talked about will be written down on these forms that I'm gonna have you just sign, and then we'll give you a copy. And also, your doctor's number's there too. You can always call their office if you have any questions.
All right, that works for me.
All right, thank you.
Go ahead and give this a sign.
Okay.
And I think everything's covered. So thank you guys
Okay,
again.
thank you.